Deciding whether or not to breastfeed is personal for parents. It's also personal to Joanne. We all want the best for our baby. But the path isn't always easy because we all have unique life situations. Whether you're a current or future nursing mom, a supportive partner, or a curious learner seeking to discover the benefits of breastfeeding, this video guide will take you from newbie to knowledgeable. In this video, we'll explore 5 stages of the breastfeeding journey and the benefits you can claim along the way. Breastfeeding is natural, and all mammals have the ability to produce milk for our young, whether it's a cow, a dog, a kangaroo, or a human. Breastfeeding provides essential nutrients to the baby while giving mothers like Joanne benefits as well. We've got 14 of these benefits to share with you. Let's begin this journey with the advantages for moms. 1. Better mental health. The first major benefit of breastfeeding is that it can contribute to better mental health. This is evident as it helps lower the risk for postpartum depression. 2. Weight loss. Our second benefit is that it can help moms lose the extra weight gained during pregnancy. That's because milk production burns a lot of energy. 3. Natural birth control. The third benefit for moms who breastfeed is that frequent and consistent breastfeeding can act as a natural birth control for a short period of time. It delays ovulation for up to about 6 months following the baby's birth. This also means that periods are delayed. After a few months, it is recommended to use standard methods of birth control to prevent unintentional pregnancy. If in doubt, talk to your doctor about your options. Number 4 on our list is that in the long term, breastfeeding has been shown to reduce the mother's risk of breast and ovarian cancer, type 2 diabetes, and high blood pressure. The fifth benefit for moms has to do with their hormones. Breastfeeding releases the hormone oxytocin. This is also known as the love hormone. It helps with the bonding process between mother and child. It is also great for mood and mental health. Number 6. Breastfeeding and the release of oxytocin helps a mother's uterus recover from childbirth by stimulating contractions after delivery. The contractions lower the risk of prolonged postpartum bleeding, helping to reduce complications from birth. The 7th benefit of our list for breastfeeding moms is that it's convenient. You don't have to worry about mixing bottles or having formula on hand. If the baby is hungry, they can just latch on and eat. And the 8th benefit of breastfeeding is that it saves money. There are no formulas, bottles, or nipples to buy, and cleanup is minimal. Before we get to the benefits for the baby, let's begin our trip through the 5 major stages of breastfeeding: pregnancy and breast preparation, early postpartum and initial breastfeeding, transitional milk, mature milk, and cluster feeding, weaning, and transition. Whether you're pregnant or still planning, it's always good to prepare if you are hopeful to breastfeed. It's always a good idea to talk to your medical provider about your plans to breastfeed. This allows you to ask questions and discuss any medical issues impacting your milk production. Your doctor or midwife can recommend a lactation consultant. Many hospitals and birth centers have one on staff who can help. You also have the option to take a class before the baby is born so that you can learn techniques and ask questions. The American College of Obstetricians and Gynecologists recommend that you have a breast pump. This allows you to extract milk from your body if you need to be away from your baby due to your job or other circumstances. There are also cases of mothers who overproduce milk, so pumping ensures it doesn't go to waste. Most insurance will cover a breast pump. Besides a pump, consider nursing bras, nursing pillows, and small blankets for privacy. Now that you've prepared, you're ready for the real thing. After the baby comes, you'll go into Stage 2, early postpartum and initial breastfeeding. Shortly after the baby is born, many obstetricians recommend skin-to-skin contact. This is precisely what it means: holding your baby directly against your bare skin right after birth, unless there is a medical issue. Most hospitals will initiate skin-to-skin contact. This helps you bond with your child and is one of the first signals to your body to release colostrum. Colostrum is the first form of breast milk and is yellow and thicker than traditional breast milk. Early postpartum breastfeeding brings us back to our list of benefits, and these are for the baby. Number 9 on our list of benefits to breastfeeding is that colostrum and regular breast milk offer an immune system boost for babies. Because it contains antibodies and immune cells from moms that help protect infants against infections, allergies, and diseases. This immune boost helps keep them healthy until their immune systems are fully developed. Our 10th benefit of breastfeeding is that it supports the baby's digestive system. Colostrum contains bioactive compounds that may influence gut bacteria. This also makes breast milk easier for babies to digest than formula, and lowers the baby's risk of digestive issues like constipation and diarrhea. Number 11 on our list of breastfeeding benefits is a big one. Research has shown that breastfed babies have a lower risk of sudden infant death syndrome, also known as SIDS. We have a few more benefits to share, but let's get back to what's happening during the process. Colostrum only lasts 2 to 5 days after birth. After that, breast milk comes into stage 3, transitional milk. Transitional milk is a mix of colostrum and mature milk. It has a blue tint and a higher fat content than colostrum, but a lower protein content compared to mature milk. At this stage, breasts usually become fuller and warmer. This stage can sometimes be slightly uncomfortable for mothers, and babies may have trouble latching. Contact a lactation consultant if you struggle to resolve this on your own. Because the breast produces more milk, mothers experience a phase called letdown. At this stage, the body knows to release oxytocin, triggering milk ejection and improving the milk flow to the baby. Stage 3 also brings us the 12th benefit to add to our list. Transitional milk takes immunity a step further by lowering the risk of infections. This helps stave off things like ear infections, respiratory infections, and urinary tract infections. The immune factors in transitional milk help the body recognize issues and get rid of them before they become illnesses. This leads us to stage 4, mature milk and cluster feeding, where some feeding changes occur. Transitional milk changes into mature milk, and you may find that your baby wants to eat in many short periods over a few hours. This is called cluster feeding. Due to growth spurts, cluster feeding helps the baby meet their increasing needs. During this stage, the baby may be fussy or have trouble self-soothing. It's also a time where there may be some sleepless nights, but the baby may benefit from additional comfort and bonding time with mom. We all know that babies don't stay little forever, so cherish this time. Cluster feedings are for the short term, but the benefits of breastfeeding are long-term. That brings us to number 13 on our list of benefits. Research shows that breastfeeding may enhance cognitive development, leading to higher IQ scores in growing children. This happens due to the essential fatty acids in breast milk that help support brain development. Eventually, it's on to stage 5, weaning and transition. The mother and baby begin reaching the end of their breastfeeding journey at the weaning stage. Weaning is the process of switching the baby's nourishment from breast milk to other foods and drinks. During weaning, parents should gradually introduce solid foods and lower a baby's frequency and amount of breastfeeding. Even when babies receive less breast milk, they will continue to benefit from a bolstered immune system. This is especially helpful as they begin trying new foods. Patience is key during this milestone. As you transition to solid food, know that your baby has been reaping the rewards of your hard work. Breast milk gives the child a huge nutritional boost. And that's our 14th and final benefit of breastfeeding. Feeding with breast milk provides the right balance of nutrients to encourage proper growth and development for optimal health. Now that we've talked about the baby's diets, but what about mom? What a breastfeeding mother puts into her body directly affects the baby. So what should a mother be eating or avoiding? Can she take medication or go on a diet? Let's explore. It goes without saying that a mom should focus on making healthy choices to help fuel her milk production. The best choices include protein-rich foods like lean meat, eggs, dairy, beans, lentils, and seafood that's low in mercury. Whole grains, fruits and vegetables, food or dairy products that contain calcium, such as milk or cheese, a daily multivitamin and mineral supplement. You can ask your doctor for recommendations on this. Be sure to drink plenty of water. Here's an interesting fact. What mom eats changes the flavor of her breast milk. So a variety of foods helps to expose the baby to different tastes. This might help when the baby starts eating solid foods. The main thing is to ensure that you're getting a good balance of vitamins and enough calories. And it's okay to eat a little more. Experts recommend 330 to 400 extra calories daily because your body needs the energy. There are also things that you may want to avoid when breastfeeding. These include caffeine. It's a stimulant, and caffeine can affect the baby's sleep. CBD products and other recreational substances, nicotine, and alcohol. Those can all get into the breast milk and affect the baby's development. Foods that cause gas but are generally healthy may give the baby discomfort. These include Brussels sprouts, cabbage, and broccoli. Herbs and herbal supplements can sometimes reduce a mother's milk supply. Ones to cut back on are peppermint, parsley, and sage. If a mom is dependent on medication for her own needs, it's good to know what drugs may cause problems for the baby. Decongestants or aspirin should be eliminated or taken sparingly. Antibiotics may or may not be safe. For this and other medications you may be taking, be sure to ask your doctor about the potential risks and benefits of medicines like these. If there is a known interaction, they may be able to prescribe an alternative. Most women gain weight while pregnant. This is totally normal and recommended for the baby's health. Experts say that 25 to 35 pounds is ideal depending on the mother's weight when she gets pregnant. But after the baby comes, not everyone loses as much as they would like. Breastfeeding can help take some weight off due to the demand created by milk production. But sometimes a little extra is needed if a new mom wants to get back to a healthy weight. If you're in this category, it's best to be smart about dieting. An extreme low-carb diet is not recommended because carbohydrate restriction can hurt milk production. Diet pills or supplements may cause problems for the baby, so it's best to avoid those. The smartest way to lose the baby weight is with a nutritionally balanced diet, keeping in mind that the body needs a few extra calories for the baby's needs. Since breastfeeding is temporary, it's best to tend to the child in the short term. Once the baby is weaned, the mother can take a more aggressive approach to weight loss with the support of a medical professional. Now that we've given you an overview of the breastfeeding journey and provided benefits, we want to stress that we understand that parents have the choice between breastfeeding and formula. Some mothers are unable to produce enough milk or breastfeed at all. Others just don't want to do it, and that is fine. Breastfeeding is not easy, even for those who have no problem producing milk. Parents who opt to not breastfeed are not failures and should never feel that way. We all want what is best for our children, and sometimes formula feeding may be a better fit. If you opt for the bottle or a mixed approach, ask your doctor for recommendations. They can usually provide samples or coupons to help you find what works for your baby. In summary, breastfeeding offers many benefits to both mother and child. You should always be vigilant about not only your baby's needs, but your own health as well. We recommend talking to your doctor if you have questions or need breastfeeding support. MedShadow helps protect our health, our family, and ourselves from medical harm, including the side effects of medication, by providing informative videos like this. Like, share, and subscribe for more health videos. Learn more about symptoms, conditions, and side effects at medshadow.org.